I was in a meeting the other day, and one of the questions that came up was understanding and knowing our clinical insights for our patients. But then we thought about it. Wait a minute. Have we asked the question in regards to what is the community insight? Do we know our patients? Do we know who we serve in the community and who walks through those doors? We conduct a citywide environmental scan for patients with chronic conditions, those living with diabetes and uncontrolled hypertension. And we wanted to also identify what those social determinants of health barriers were that prevented some of these individuals in accessing appropriate and culturally competent healthcare services based on where they lived. What we discovered was powerful because it gave us a community insight in regards to how our patients were accessing services and what barriers they had, and why some of them were not improving their chronic condition. They came day after day to primary care provider, but when it came to accessing specialty providers, it was a significant barrier. So the question then is again, do we know the community insight of our patients? Not only the clinical insights, but who they are as individuals. I believe that once we start looking at who the patient is outside the clinical walls and who they are in the community, it will truly tell us a full comprehensive story of who we are caring for. So the question is, does your healthcare organization or your clinic know who your patients are? And do you have that community insight? Please come back to us and listen more insights of Dow Consulting Services.